So we're now live, Chairman.
Thank you. Good afternoon, everybody. Welcome to this meeting of the Children and Families Advisory Panel. This meeting is being held remotely and members are in attendance via video conferencing. The meeting is being streamed and will also be available for repeated viewing. I will begin by naming the members who are in attendance for the public record and asking members to confirm their attendance. During the meeting, if a member wishes to speak, they will indicate this by raising their hand and I will call them to speak in turn. All agenda items are for noting today and I will ask members to verbally indicate their agreement at the end of each item. I would like to remind members that the County Council standing orders continue to apply to please keep your microphones muted unless you have been called to speak and that you may be visible on the screen to the public and other members at all times. I will now call on those members in attendance. Members, please unmute and confirm your attendance for the record and ensure that you can be heard. Councillor Hare.
Present, Chairman.
Thank you. Councillor Boyles. Councillor Briggs.
Present, Chairman.
Thank you. Councillor Carpenter.
Present, Chairman.
Councillor Edgar.
Present, Peter.
Councillor Mitchell.
Present, Chairman.
Councillor Porter.
Present, Chairman. Good afternoon.
Good afternoon. Councillor Wade.
Present, Chairman.
And can I welcome the Executive Member, Councillor Stallard.
Thank you, Chairman, and I'm obviously present.
At the moment we don't have Martin Boyle, so if he doesn't turn up, we need to record him as absent. Do we have any apologies for absence at all, please? Emma?
I haven't received any apologies, Chairman, no.
Right. Declarations of interest. Does any member wish to declare an interest on any items that are on this afternoon's agenda, please? I see none. Item 3 is to confirm that the minutes of the Modern Gov Gender Pack from the previous meeting held on the 13th of October 2020. Are members happy to record this as a correct record, please? Is that agreed? Thank you.
Agreed.
Deputations. There are no deputations today and I have no chairman's announcements. So we go on to item 6, which is Principal Social Worker Children and Families Report. And could I ask for Kathia Maxey to present this, please?
Good afternoon, Chairman. Good afternoon, councillors. My name is Kavitha Maxey and I'm the Principal Social Worker for Children and Families for Hampshire County Council. Thank you for allowing me the opportunity to present this report to yourselves. This is a report to provide the panel with a high-level briefing of the roles and responsibilities of the Principal Social Worker for Children and Families in Hampshire. There is a Principal Social Worker for adult services also, and she is Jess Hutchinson. I'm going to go through the report and pick out the highlights. You've all had sight of the report, so I will not be going through it in a great level of detail. This role was born from the 2011 Eileen Monroe report in respect of when a child protection review was undertaken by Professor Eileen Monroe on behalf of the Department for Education. And she found in one of her recommendations that local authorities should designate a principal child and family social worker who is a senior manager with lead responsibility for practice in the local authority and who is still actively involved in frontline practice and who can report the views and experiences of the frontline to all levels of management. In Hampshire, our Children and Families Management team have set out some objectives for the role, which came into being in Hampshire in 2017. There are 3 main focus areas for this role. We are a learning organisation in Hampshire, and one of our aims is to provide an environment where there is continuous professional development for our social workers, which include high quality practice placements and the creation of where social work can can flourish, where excellent social work can flourish. The second area of focus for us is the monitoring of frontline practice and assuring that the service we provide to children and families is of the highest possible quality. And in my role, I provide that advice, guidance and direction to practitioners and managers around practice and around the model and approach that we take in Hampshire. And one of my privileges within this role is being a key communication link between the frontline staff and senior management, so that people who make those strategic decisions within the organisation for children's services and social work services are duly cited on the operational and challenges and successes of our staff on the front line, especially at a time like this when things within COVID are changing on a very, very regular basis. There are two main areas of focus within the operational responsibilities within this role. One is around leading outstanding practice, and the other is around supporting our staff. Within the leading outstanding practice, although this is a role that was born to drive excellent social work, I do widen the net out to our child and family support workers, our intensive workers who are not qualified social workers but work very closely with our families. So this role reaches out and doesn't only focus on our qualified social work staff. There are 6 areas under the leading practice heading. The first and possibly the most wide-reaching and important being the Hampshire Approach. So within my span of responsibility, I drive the Hampshire Approach, what we call the Hampshire Approach, so our strength-based, family-focused approach when we work with families. This includes the models that we use and we've all been trained in over 2019 and 2020 around motivational interviewing, solution-focused practice and restorative practice. We have embedded our new assessments with families, and this is a strength-based assessment. We have rolled out planning following on from that, and this year our focus will hopefully be embedding some of that excellent practice and looking forward to how we thread this approach into our intervention with families and our direct work with children. I also do case file audits and practice observations, all as part of monitoring the quality of our practice and that quality assurance role. There has been a real drive over the last 2 years about capturing identity in a really holistic manner, and that is point 10 on my report, where I have conducted some thematic audits, and this has resulted in some learning for us, which I will be taking forward in terms of some sessions with staff across our operational teams. Service development, quite a broad heading, but that comes in the shape of many things, including our response to Ofsted, how we create our service plans for the next year that line up with what we need to be focusing on, what we're hearing back from our staff, but also from our children and families. A really unique thing, and I don't think I've heard of this in other local authorities, is our PSW buddy network. Because of our size within Hampshire, it is not always practical to be present in every district and in every service. So we have 2 or 3 representatives from each of our districts and services, including our fostering and adoption, youth offending, residential and our independent reviewing service. And they form that really key feedback channel between their colleagues and the PSW and in turn the senior management team. I'm also part of the regional network and the national network for principal social workers, and our regional group include the Isle of Wight, Southampton, Portsmouth, Wokingham, Bracknell Forest and the Royal Borough of Windsor and Maidenhead. The second key focus, as you can see, or the key heading in which I've structured this report in, is around support for our staff. We run health and wellbeing events that I lead in all the districts and services, and we concentrate on 3 things: what's working well, what could be better, and what are the solutions that staff themselves are suggesting. I found this in the last 2 years to be a really successful model, even if it is just for people, especially in the last 12 months within the pandemic, to talk about their own well-being and share good practice, which people have found really useful. We have the social work survey, which we do annually. The next one is in April 2021, and this is a good source of information, which we use the "you said, we did" element of hearing from staff and doing something about it. We have exit interviews, which are quite self-explanatory. When people leave the organisation, we are thinking about changing that to retention interviews, to think about and be cited before people think of leaving as to how we can help them to stay and work with us. One of the things that came out of the social work survey, and also, as you know, the national picture around Black Lives Matter, is the BAME development group for our newly qualified social workers. This has come from some requests that we provide a forum for our Black and minority, our Asian and ethnic minority social workers to think about success and what they would see from their point of view as success within their first year of practice. And we have the PSW also has a communication site on our SharePoint and a Yammer page, which is a means of communication and sharing of good practice. So really, the role is an active and evolving role. And in Hampshire, the model that we work with, because of our size and because of the layering that we have within the Children and Families branch, is that the expertise lies within the organisation and within the districts and services. And I form that link. So although I don't do all the doing, our district managers and service managers take responsibility and are accountable for driving practice in their own districts and services. Thank you very much. It's been really good to have an opportunity to share this with you. Thank you. Thank you, Chairman.
Do we have any questions at all, please? Well, excuse me, I've got one I'd like to kick off with. You were talking about staff and if they leave. Do you carry out exit interviews if staff are leaving so that you can understand why they're leaving and perhaps even persuade them to stay or understand why they're leaving?
We do. We carry out exit interviews. So all our district managers and service managers and our team managers are aware that when someone has talked about leaving or perhaps handed in their notice, we refer them to our workforce development team who carry out these exit interviews. This information is collated on a regular basis and we report this to our Children and Families management team on a 6-monthly basis. So themes are drawn out and we try and address some of those things if there are thematic issues that we can tackle.
Thank you. Councillor Briggs.
Thank you, Chairman. Actually, my question was going to be about the exit. So how many people have left during this COVID pandemic? Are we doing well, or have we lost a lot of social workers?
We haven't lost a lot of social workers during the pandemic. There is some movement. Councillor, I'll have to go back and refer to my previous report to get the exact numbers for you. I'm not able to recall it just off the top of my head. But we haven't had, there is some movement, but I don't think we've had the level of movement that perhaps other local authorities have had.
Thank you. And may I have one more question, please, Chairman?
Off you go.
Thank you. With the Hampshire approach, which we do things differently, which I think we're doing well, if you have a new social worker coming in from, say, Surrey, how much difference do they find with the way we work to other authorities? Do they have to have a lot of training?
They find it quite different. They find it quite refreshing. For example, the language in our assessments is written to the child and family, and social workers find this really empowering to do. Yeah, there is a rolling program of virtual training on our approaches, and they can access that if they are a permanent member of staff. Our team managers and our assistant team managers are well cited on what needs to happen straight away in terms of that approach, and discuss that within supervision. So that's covered off, and we do have the access to the training, which is all virtual now, so all access.
Oh, I know. Okay, thank you very much.
Councillor Porter.
Thank you. And Kavitha, thank you. Really nice to meet you. I wondered how the role of the directorate and the principal social worker interact. I wonder if you could try and explain that. How does that work for you as the principal social worker in your work with the directors and assistant directors? How does that interact? You've talked about going downwards and how you work downwards. How does it work outwards and upwards?
So I'm managed by Alison Smales, who is part of the Children and Families Management team, and the assistant director is also part of that team. So that's where that link happens. My reporting to Alison and Alison will take that up to Stuart Ashley, who's our assistant director, and is in this meeting, and Stuart will take it to Steve. So that's the interaction that happens. There are various models that are used, councillor, in different local authorities where, for example, in some smaller local authorities, the principal social worker may sit on that management team, for example. But in Hampshire, this is how it works, that I report to our head of service, who is part of our Children and Families Management team, and a lot of the interaction and what goes on a day-to-day basis operationally, the Children and Families Management team are well cited on. So it's almost a complementary relationship, if you like. So the pieces fit together quite well, I think.
So I noticed you said quite rightly, we're a learning council. So how do you take the learning? Does that learning get reflected in policy, or is it a practical pastoral role in that sense?
It does.
The bit working with staff.
Sorry.
Go on.
Yes, it does get. So I manage the policy officer, so the project officer who deals with all the policies and procedures and guidance for children and families. And there are various. It is a bit of a mapping exercise, if you like, but there are various tributaries in and out of my role. And I have with my service development hat on, for example, I look at our self-assessment, what things that we need to do to improve. We line that up with our children's services performance manager, for example. So there's lots of things that happen to all fit in. And because I have that lead for the policy and project officer, and I also have the lead for the communication site that sends things out to practitioners, it all sort of follows a certain channel. And I cannot say that I see everything that needs to go out, but somebody at this level will be cited on it, and the communication does get shared more widely within our county performance meetings, our practice improvement kind of meetings, which we call our DM workshops, our district manager workshops. So there's several platforms, if you like, for sharing and taking it back and closing that loop.
Thank you for the introduction of the telephone, but thank you, that's really helpful. It gives me a much better idea of how it goes up and down. Thank you.
Councillor Wade.
Thank you, Chairman, and thank you for a very interesting presentation. The role that you're in for Hampshire is relatively new. Yeah. And you mentioned that we do things differently, and I'll go along with that. I think we do things better than probably a lot of other counties. But what do you see as the biggest challenge in your role? Forgetting the fact that we're in a pandemic at the moment, what do you see as the biggest challenge in the role under normal circumstances?
That's a really good question. For me, the most important thing for me is the well-being of our staff, because I think we have a really good structure and system in place. Our policies and procedures are clear, they're there, they're present. We have a really stable management structure. We have a director and an assistant director and a management team who are stable and who always give us consistent messages. What changes and what's dynamic is the well-being and the staffing and the recruitment and retention. So it's two things, I think. It's concentrating on the well-being of our staff, and within that, certain groups of staff, people who have protected characteristics, for example. But the other layer of that is keeping on top of that recruitment and retention and contributing strategically to how we can make that work for us in Hampshire. And that's without accounting for a pandemic, as you said, Councillor. So I think well-being.
Can I just come back? That's a really good answer. Thank you for that. Is there anything that we can learn from other councils?
Yes.
That would help us to do that better? That's the second part of that question, if that's okay.
Yes, of course. Our regional and national networks are really helpful in that respect. And we on a regular basis share, for example, how a local authority will deal with a virtual student placement and where the pitfalls are and where the successes are. And yes, we're always learning. There's always there's always room for learning. We are seen as pioneers and people who do it really well. But we do keep learning, Councillor, as you said, and there are various things that we can learn from, which we're doing on a regular basis anyway through sharing.
I wonder, Chairman,
okay,
if I
thank you.
Add to that. If I could just add to that, Councillor Wade. I've made a note here because Kavitha mentioned that in some authorities the principal social worker is part of the senior management team, and I've just made a note here that probably warrants another discussion, actually, because Kavitha has evolved this role. It wasn't really well established, and I think it is now. And so I've just made a note to have that conversation outside of here. I don't want to put Kavitha on the spot, or indeed myself, but it's just part of the evolution of the role, I think. So we're constantly looking at how we can improve things and do things differently.
You happy with that, Councillor Wade?
Yes, thank you for that, both of you.
Okay, thank you. Councillor Stallard.
Thank you very much. Councillor Wade has already answered one of the questions I was going to ask, but I'd like to pick up on a point just made by Stuart Ashley. Can I congratulate you on setting up the BAME development group for newly qualified social workers? I think that is very innovative. I just wonder how long ago how new is it? I know it's new, but how new is it? And is it unique, or have other local authorities done similar, or are we unique? And I just wondered how you see that developing. I mean, is this something that we might later on be able to share with other local authorities? And my final point is really a comment just made by Stuart about input into a senior management team. I think the work that you're doing is extremely important.
Thank you, Councillor. So your questions about the BAME group, it is very much in its infancy. We deliberately took the approach that we were not going to do unto, that we needed to find out from the people who would benefit from this as to what they needed. So it's been an iterative process. We've framed the terms of reference. We've framed how we're going to approach it, because it's a sensitive subject. What we don't want to do is say, you know, this whole group has developmental needs and these are the needs. What we want to do is make it a collaborative process. So at the moment, we're in the stage where we have framed the terms of reference. We have thought about the logistics, and now on the 23rd of February we have a focus group with our BAME staff and other non-BAME staff to think about two things. What is the need? And the second bit is, what do you think the terms of reference? We have some draft terms of reference, but what do you think the terms of reference of this group needs to be, to the extent where we'd like them to actually think of a name for this group? They might not think a development group is an appropriate name. We are working with the staff BME network on it. So we have the chair and the vice chair of the BME network contributing to it, which is extremely valuable. So it's very much in its infancy. On your question as to whether other local authorities do it, I am not able to answer that because I don't know, but we do know that there are other local authorities that have developed resources that can be used with BAME families who they work with, and we've shared those within the national PSW network. But in terms of having a staff group for newly qualified social workers, it's definitely not happening regionally. It is what I do know. So regionally, it is unique, and hopefully we'll be able to share the learning with our regional partners. I think I've answered all your questions, Councillor.
Yes, you did. Thank you. It's very interesting. Thank you.
I have one more question, and that seems to be from Councillor Hare, please.
Thank you. Hello, Kavitha. Actually, Councillor Stallard has actually touched on what I was going to say. It's not actually a question, it's a comment, really. It's really welcome what you're doing with the BME, your points 10 and 17. And as Councillor Stallard was asking about other local authorities, I don't know about local authorities, but I certainly know that lots of corporate companies are following this lead. Certainly the one that I work for, and it's really good learning about diversity and inclusion, and having a champion, and actually highlighting this and understanding all this, which is really good going forward. Thank you.
Thank you. And in terms of the link with the management team, that was the earlier point. We also we're just in the process of setting up an inclusion and diversity steering group, which is managed at the AD level, so to sort of gather up all the intelligence that we have and all the work that we're doing in various streams to form a corporate agenda around that. But the BAME group is a response to a need that we're trying to fulfill.
Kavitha, thank you very much for your comprehensive and very interesting and knowledgeable answers. One quick question: what is our Ofsted rating?
What is our Ofsted rating?
Yes.
Always outstanding.
I know. Thank you very much indeed. I thought that was going to be the answer. I asked a question which I knew the answer to. I think it's always nice to blow our own trumpets occasionally, isn't it? Right. Thank you very much for that. Members, the recommendation is to note to a report. Are you happy to note it?
Agree.
Agree.
Thank you very much. Thank you very much indeed.
Thank you
for your help on that. We move on, members, to item 7, and that is the Hampshire Safeguarding Children Board 2019-2020 annual report, and I think we have Tim Sandel here who's going to present that report. I hear Tim.
I'm here, Chairman.
Thank you. Off you go.
Thank you. So good afternoon, everyone. This report provides a summary of the Hampshire Safeguarding Children Partnership annual report, which covers the period April 2019 to March 2020. And the annual report provides an assessment of the effectiveness of agencies across Hampshire to safeguard and promote the welfare of children. The report's main highlights are that Hampshire's Safeguarding Children Partnership has ensured the implementation of arrangements as set out in Working Together 2018, that safeguarding arrangements in Hampshire have continued to improve, and there is positive progress in many areas of child protection, with strong and integrated frontline services maintained within the partnership across Hampshire. The children across Hampshire are seen, heard and helped, and what I mean by this is that they're seen in the context of their lives at home, friendship circles, health, education and public spaces, both offline and online, that they're heard by professionals taking time to hear what children and young people are saying, putting themselves in the children and young person's shoes and thinking about what their lives might truly be like. And they're helped by professionals remaining curious and by implementing timely, effective and imaginative solutions to help make children and young people safer. So the main part of the report is the business plan, which outlines the 3 strategic priorities for the partnership, which is to further embed and evaluate Hampshire Safeguarding Children's Partnership initiatives, to strengthen assurance programmes and leadership and transformation. And this was required to ensure a smooth transition to the new arrangements in Hampshire, which were outlined in Working Together 2018. And the 3 key themes running through the priority areas are that the voice and lived experience of the child, multi-agency partnership working, and lessons are identified and learned from case reviews and multi-agency audits. So the Hampshire Safeguarding Children's Partnership continues to deliver its agreed programme of initiatives to safeguard and promote the safety and wellbeing of children and their families across Hampshire. And the Safeguarding Partnership is assured that services provided to children and their families in Hampshire are timely, appropriate and effective. And that assurance comes through agency responses to Section 11 audits, and we're just completing one at the moment, and their action plans, visits to agencies pre-pandemic, but also evidence progressed through the children's workforce, understanding and awareness of policies and required practice, and that is through auditing. Chairs and subgroups monitor the progress of their work plans at quarterly meetings and through the action trackers held for all subgroups, and progress is reported to the business group. The updated local safeguarding arrangements have been recently published, so in effect that's our constitution, with implementation completed in line with Working Together 2018. And the Hampshire Safeguarding Children's Partnership published the Child Death Overview Panel, that's known as CDOP, arrangements with the implementation in place, again in line with Working Together 2018. And we're also working in partnership with the Isle of Wight, Portsmouth, Southampton. And one of the launches that we've discussed in the annual report that you may have seen is the Family Approach Protocol and Toolkit. So the Family Approach promotes that safeguarding is a shared responsibility between the family and professionals. So the whole family approach is a family-led strategy which provides adults and children with the tools to set and plan for and objective their goals together. So it's working collaboratively with the family. And the family approach ensures that there is professional multi-agency joined up working. So often with these families, as you're aware, there is more than one professional. So it is that completely joined up piece of working with the family. And to support the family, to identify any protected individuals within the family and to provide support to address risks together. The Safeguarding Partnership, again, in partnership with the Isle of Wight, Portsmouth and Southampton, has set up the ICON project to reduce abusive head trauma in babies. So ICON stands for I, that's infant crying is normal. C, comforting methods can help. O, it's okay to walk away. And finally, N, never to shake a baby. So the ICON is all about helping people to care for babies to cope with crying, essentially. And the ICON campaign was a response to a number of infant deaths and serious case reviews where a baby has died or been seriously injured as a result of abusive head trauma. It's also known as shaken baby syndrome, which can, as you're aware, it causes catastrophic brain injury, which can lead to death or significant long-term health and even learning disabilities. The programme provides key messages and resources to let parents and carers know that infant crying is normal and that there are methods which can be taken in order to cope. Resources include leaflets, posters and video clips which can be shared with parents and carers at any contact had with midwives, health visitors, GPs or social workers and other professionals working with families. And this ICON project is now a national project. And I just want to point out that there has been a significant rise in abusive head trauma nationally over the last year, but not so in Hampshire. And I think this is in part due to the awareness raising of the ICON project. The Hampshire Safeguarding Children Partnership also supported the development and launch of Every Sleep Counts with practical sessions at venues across Hampshire. Every Sleep Counts campaign is aimed at parents of newborn babies, and this raises awareness of the dangers of co-sleeping to reduce the risk of sudden infant death syndrome. I just want to really talk about current work in progress. So currently our plan is for the evaluation of the ICON and Every Sleep Counts campaign, and this will be undertaken throughout 2021. And again, in collaboration with the Isle of Wight, Portsmouth and Southampton, we are supporting the Lurking Trolls campaign, which is a campaign launching materials to be rolled out in schools, particularly primary schools, looking at online safety for children. The revised neglect strategy toolkit has been launched today. In fact, I've just come from that launch to be here with you. The neglect strategy and toolkit have been developed to support frontline professionals and managers who work with families to identify and respond to issues of neglect. So I'd just like to conclude. So the annual report provides evidence that safeguarding remains a firm priority for all partner agencies across Hampshire, and this is demonstrated by consistently good levels of attendance and effective engagement in subgroups, even despite the pandemic, and a strong culture of constructive challenge and debate. The multi-agency work within partnership groups and subgroups promotes work to drive a range of improvements to both the safety and welfare of children and young people. Partnership membership extends across several working groups to provide continuity. And I think, finally, key to our success has been a focus on different safeguarding contexts that exist across Hampshire, with an emphasis being placed on children and young people being safeguarded in the lives of their home, in their friendship circles, in health, in education, and in the public spaces that they occupy, both offline and online.
Thank you. Do we have any questions at all, please? No questions? Well, you've obviously given a good presentation, Tim. Members, the recommendation is to note the report.
Chairman, I think we do have a couple of questions.
Right, we have got some hands up. OK. Councillor Briggs and then Councillor Porter. Thank you.
Thank you, Chairman. Mine's not really a question, it's a comment. Thank you, Tim, for that, because I think unless our children are well safeguarded, that is the most important thing, I think, that we do. Safeguarding's top of the priority for all of us. You have covered the new child death overview panel, because I've never seen that before. Is that new, or have we always done it?
Well, it's not in the format's changed with Working Together 2018, and but it's always so serious case reviews have always been reviewed. It's just the way they've been reviewed.
If I can add to that, Chairman, so there are two different groups. One, the Child Death Overview Panel looks at themes around deaths in all children, whether that's through smoking, road traffic accidents. So it's a sort of public health driven meeting. And then there is the Learning and Inquiry Group, which I chair, which looks at deaths or serious injuries to children as a result of abuse or neglect. And they are two different things. Tim referred to some serious case reviews, which is they're undertaken by the Learning and Inquiry Group, and they are different to the Child Death Overview Panel. Unfortunately, we don't have very many at the Learning Inquiry Group, but we, every year there will be a small number that are presented.
Thank you. Can I just ask, if a family have harmed a newborn or shaken, and then they have another child, do we step in there? Do we keep an eye on them? And I don't know how much you can interfere or.
Well, it's not interfering.
No, I didn't really mean it.
So the answer is yes, we do. Maternity Services will, or the GP or Maternity Services will refer when they know there's a history of child abuse. We will usually undertake a pre-birth assessment. So we'll speak with the family, we'll see what's changed and understand it. We will, on occasions, the unborn baby will be subject to a child protection plan. We may issue care proceedings at the time of the birth because we think the risk is too high, and the judge will be asked to make a decision as to whether the baby should stay with mother or be removed shortly after birth. They are really obviously exceptionally difficult decisions, but all of those are done on an evidence basis and overseen by a judge. But we would certainly make sure that where there's a known history, that we would continue to be involved until the point, and we have to recognise that things happen and people change and families move on, and there may be cases where actually we're not needing to be involved longer term in the future. But that's about professional risk and risk management, and that's not just children's social care, that's health professionals, that's the police, that's the whole partnership making those decisions.
Thank you, Stuart. Thank you, Tim.
Councillor Porter.
Reassuring.
Thank you. I noticed we have the partnership has a business plan, and I wondered how, I can't see anything exactly how it's funded. Is it completely funded by Hampshire County Council, or is it funded through partners as well?
It's funded through partners, Councillor. So there is a breakdown in the annual report of the partnership.
I can see that
Sorry, Councillor Porter.
I can see where the partnership's broken down in terms of action, and it's the budget. Perhaps I missed the income then, obviously. So the income is primarily from the county council, or?
Well, yeah, the majority comes from children's services, but there was also funding from the other partners, health and the police, but the majority from children's services.
Right, okay, thank you. And the second question I was going to raise is that we've concentrated today on the ICON project as a conversation. You obviously have other initiatives that have started in previous years. How are they pursued as part of that process, of this process?
So I spoke about the neglect strategy, so that's just been relaunched today. That was initiated in 2016, and then it's been revised and updated with a toolkit for practitioners. There's also, I did talk about Every Sleep Counts, which is also about the dangers of co-sleeping and raising awareness there.
And so I presume that these have to be relaunched from time to time.
Yeah, and ensure that they're embedded. I also spoke about Lurking Trolls, which is an initiative across the partnerships along with Southampton, Portsmouth and the Isle of Wight to look at online grooming, particularly with children in primary schools. So there are a number of task and finish groups. So currently I'm working with a task and finish group called Dare to Share, which is looking at information sharing, beyond the confines of GDPR and data protection, and what some of that soft intelligence where professionals might be unsure. So the dustman notices something strange, should he escalate that up? Should that be shared with the police? So there are quite a number of different groups going on to look at safeguarding across the children's workforce across Hampshire.
I suppose my question is tied up really with it's great having lots of new initiatives, but it's how to maintain those so that the public understand them and follow them through. I mean, Childline's a perfect example of something where everybody knows, and it's endured the generations. And these are all excellent, absolutely excellent initiatives, and what we want to make sure is that they become generational as opposed to just seasonal. And that's what I'm asking the question about, really.
So we do this by a number of different ways. So that first of all, it's ensuring that that those messages are embedded within the workforce, which we do through our auditing, through checking out with the different agencies, and also, as you say, getting it out to the public. Well, that's done through the workforce. So raising that awareness, providing those skills, those resources for health visitors or midwives or social workers, to police officers, ambulance crews, to have those resources and skills to take that out to the public. We also have our website, which has information both for professionals and for the public.
Okay, thank you.
Councillor Carpenter.
Thank you, Chairman. Yes, so it's really good to see the ICON and the Safe Sleep initiatives there. When I visited the MASH a while back now, one of the cases that I actually was able to see firsthand was a baby that came into a hospital and they had to look closely at what was happening with it. And it was to do with both of those things, interestingly enough. But my question was really similar to Councillor Porter's. I haven't seen any sort of publicity personally of our work around these issues, and I just wondered, where do you put your messages out? You did actually answer it partly with Councillor Porter.
So it's not just through the workforce, but of course they're often the first point of contact. The GP surgery, for example, the community centre. And I mentioned our website, but we also use Twitter, tweet. We have a news item that goes out. So, we are promoting, and continuing to promote these initiatives and ensuring. But it's, I'd say, if I'm honest, it's mainly through our workforce, because they're the point of contact with the community. But we are, continually looking at ways of promoting that, and so I'm at the moment I'm looking at our website, and I'm wondering if we might be to develop apps which would be links to information. So, for example, Councillor, I was thinking about private fostering. So if you're a family and you're thinking about looking after someone else's child, how could you get the information very quickly? And it might be that we start to look at maybe using apps to provide very quick information for people as they need it, because the pandemic has changed the way that information is shared, the way that all of us, isn't it, in terms of whatever it is, looking for information, shopping even that way, and it's a much more virtual world that we're working in, and I think we need to move with the times and look for those kind of initiatives. So I have a number of ideas that I want to try and push forward.
Yeah, because I think those messages are really important for all parents to hear, especially brand new parents. They need to know that there are dangers.
And it's an incredibly difficult time, isn't it? Because we're all locked into our houses, and so even more so at this time than before. I think it's really heightened. And I think as I said about the ICON programme, I think that awareness raising has had an effect, because in Hampshire we haven't seen the same levels as other areas nationally have, and I think that is partly due because we were quick off the blocks in terms of developing that project.
Thank you very much. Thank you.
Councillor Hare.
Thank you, Chair. Thank you, Tim. It's a really quite a long report, very, very, very helpful report. I wanted to go back to the Safe Sleep campaign thing that we're talking about. I know safeguarding is a priority in every way, in every manner. Even Ofsted, safeguarding is their first priority when they go into schools. I want to know, do we have enough resources to help the young parents with complex needs? I know in the report you have a scenario of a young mother who's got complex needs, but there's obviously other young parents and families with complex needs. Are there enough resources there?
Yeah, I think there are, Councillor. I mean, this is something that we continually test out when we're auditing the different agencies, our partners, and overseeing them. That's obviously ensuring that the resources are in place is something that we ask for their assurance on, and I consider that we do, but I'm not saying that we can't be better. And for example, I know it's not quite what you've asked about, but I've just come from this neglect strategy launch where part of that toolkit for working with neglect is a whole raft of tools and resources for professionals working with parents with learning disabilities. And so I think it's something that we are mindful of, and it's something that we are continuing to develop with our partner agencies to ensure that those are in place. And it's about when we're promoting those messages, it's looking at the different forms of communication. So there isn't just one form of communication. We have a different ways of communicating and providing those resources to the whether it be the health visitor or midwife with new parents talking about co-sleeping, ensuring that message gets across. Because safe sleeping is quite an emotive subject, isn't it? the parent that's desperate for sleep, the baby's crying, automatically will think about taking that baby into bed. But it's ensuring that they have the information they need and to know what the potential dangers and risks are.
Thank you. May I just sorry, Chair. May I just ask another quick question about this report? This report is obviously until March 2020, and I take it that the next, is that March 2020? And your next report is going to be completely different, isn't it? Yes. Because it will be more COVID related. So do you think there's going to be, is it going to be very different, or is it going to be something similar?
I think I can tell you that obviously with the pandemic coming in and lockdown in last March, the landscape changed so quickly. And even if you think about where we were in November and December and where we are now, that changed very quickly. So I think it will be a very different report. What I think it will highlight is how quickly services in Hampshire responded to the pandemic and responded to the risks to children. So, when children weren't being seen in school because they weren't in education, there was a swift response, and joined up working. So, police and children's services going out on visits. I think there was a sharing of the workload, and I think a lot of the, I'm not saying there wasn't necessarily silo working before, because there wasn't. We were working in a joined up way, but I think that what the pandemic did was make that more of joined up working. So I think there are a lot of strengths and a lot of innovations come out of the pandemic, and a lot of new ways of working, which due to a response from the children's workforce across Hampshire.
Thank you. I have one more question from Councillor Wade, please.
Thank you, Chairman. Let me just put my hand in. Yeah, Tim, thank you for the report. It was interesting. I've got one question about care leavers. I noticed in the report the priorities for the next 12 months were housing, and we're sitting on the corporate parenting board. We're aware of that issue. But the other one is about mental health and emotional issues. Now, looking at it pre-pandemic, what can you give us a sort of feeling for how big an issue the mental health issues are for our group of care leavers, accepting the fact the pandemic is going to influence this by a different way? Because it's a priority to work on. How big is the problem? Is that a fair question?
I think it's I think if you look at the national reporting, that mental health and well-being is an issue across the nation, and I think work with the care leavers is a response to that, because they're no different, are they, from any other young person? They often they may have had difficult early life traumas that may well have impacted, but I think it's about being aware and focusing on our care leavers, because obviously we have a duty to respond to them as corporate parents.
What I was trying to get at, if you can just go on, is that clearly those young people have not had the best start in life. But do we have a handle on how big an issue that is to the cohort of care leavers compared to the cohort not of all of children that are in care? I mean, how big an impact is mental health on their future life compared to children that haven't had that experience? Because this is something that we've not really thought about before. I haven't thought about it anyway. I'm sure probably you guys have. But I just wonder, how do we see that as a problem that needs to be addressed, apart from the generalistic point of mental health being important for everybody? Do you understand what I'm asking?
Yeah, I think the only way I can answer that is to say that, that is about ensuring that that cohort of young people have the right support in place. As you said, Councillor Wade, we recognise that they've had, potentially early life trauma, the experience of being in the care system, and that if you factor in what's gone on in terms of the pandemic, it's ensuring that those supports are in place.
So it's a bit of a work in progress.
Yeah.
What if I could just add something there, Councillor? Of course, there will be disproportionately more care leavers with mental health problems as adults than the general population. That's a given, isn't it? The numbers, I mean, I worry sometimes when we try to put the numbers on it, because I think these are our children in care who then go on to be adults, and sometimes we might have a group of young adults who have got mental health problems. Sometimes we won't, but generally they will be more, mental illness will be more persistent in care leavers, as Tim says, because of the trauma that they have experienced. And let's be clear, when we say trauma, sometimes we need to be blunt and say the abuse that they have suffered as children, that they will take many years for them to come to terms with. As when they are children in care, we do what we can, as you know, and members have heard from CAMS about the work they do with our children in care. But of course, we can't avoid the issue. The threshold for CAMS is somewhere down here, and for adult mental health provision, it's up there, and it's ever been thus. So there is a gap. So children, when they're 16 and 17, receiving a service from CAMS may not receive a service from adult mental health because the thresholds are different. What we do in children's services is try to fill that gap with other services, so that whilst that they may not get professional mental health input if they don't meet the criteria, they may be accessing counselling services, they may be accessing other therapeutic services, and that's part of what the care leavers, personal advisors do with those care leavers. Sadly, there are always a very small number who won't engage in that process, and we hope that later in life they feel more able to engage. But I think you're right to raise it as an ongoing issue. I thoroughly endorse that.
Thank you. Can I just come back to it? I totally understand all the points you've made, and absolutely right. We do the best we can. I'm just trying to understand if we have a handle on the size of the issue, so that a proportionate response can be developed in the future. That was trying to understand, because it's something that we hadn't really thought about before in terms of how big a problem it is. And as it's a priority in the report, therefore there obviously is an issue. It's just understanding how big the issue is or not. And I totally understand their beginning in life is going to generate a more challenging future for them in many respects, because of experience. I was just trying to understand, Stuart, how do we network that sort of issue? Thank you.
It is a hard one to answer, because of course there are degrees of mental health issues, from emotional well-being through to chronic mental health. If we say we have a roundabout, and I'll use some rounded up figures. Let's say we have 650 care leavers. Of those, I would expect 10% to need significant input, and another 10% to need less significant input. Remember that the numbers of our care leavers are swollen by unaccompanied asylum-seeking children, and they very often have experienced the most chronic trauma. And so I would remove those from the figures, if that makes sense. But if you play the unaccompanied asylum-seeking care leavers into that, I think we could safely say it would be 1 in 4. They have just journeying to the UK is traumatic in itself, and some of the stories that they tell are, dreadfully distressing.
Okay, thank you.
Thank you, Stuart. Tim, thank you very much for your presentation. Very kind of you to come along and give us your expertise this evening or this afternoon. Members, you are requested to note the report. Are you happy to do that, please?
Noted.
Thank you. Many thanks. Okay, somebody have a question? No. Okay, can we move on therefore to number 8 on your agenda? And this is the Independent Reviewing Service annual report. And I believe we've got Karen Cairns. You're here to present that to us. I think up to Karen somewhere. There she is. Okay, yes, thank you. Over to you.
Good afternoon, Chairman and Councillors. My name is Karen Cairns, and I'm one of 2 lead independent reviewing officers. And I don't intend to go through the whole report this afternoon, but we'll take you through some of the key points. The annual report summarises the work of the Independent Reviewing Service in line with the key areas specified in the statutory guidance. identified areas of good practice and a positive response to the service to the COVID-19 challenges. The IRS has contributed to transformation and development work taking place across the department, including the embedding of the Hampshire Approach. The report also acknowledges the areas for further development of the service, most notably the improvement of the IRS quality assurance to evidence the impact on outcome for children. The reviewing service in Hampshire has the dual responsibility of chairing child protection case conferences and children looked after reviews. We currently manage the service this way as it gives us continuity for children and their families. Therefore, if a child is on a child protection plan and then becomes looked after, the chair will automatically become the independent reviewing officer for that child, as they would have already built up a relationship with the family and have a good understanding of the child's experiences. The annual report covers the period from the 1st of July 2019 to 31st of July 2020. By way of context and background, at the end of January 2019, the number of full-time looked after children in Hampshire was 1,677. At the end of January 2020, this figure was 1,600, which represents a decrease of 4.81%. During the same period, the number of children subject to a child protection plan decreased by 269 from 1,204 to 935 at the end of January 2020. This represents a 22% decrease. In terms of activity for the period covered by this report, 2,400 child protection case conferences were chaired and 4,719 children looked after reviews were undertaken during that time of full-time looked after children, which also included statutory adoption reviews. There are some clear indications that the ongoing programme of the transformation in children's social care over the recent few years is having a positive impact on the number of children being able to remain safely at home within their families and their local communities. The emphasis of the programme on reunification and permanency and the application of strength-based family work initiatives, including multidisciplinary specialist and intensive workers within social work teams, indicates positive outcomes in regards to the number of children in care and on child protection plans. The independent reviewing service continues to focus on ensuring reunification is achieved in the safest and most timely way, including examining how the service can develop their own strength-based practice to ensure continuity of experience for children and their families. In March 2020, the COVID-19 pandemic resulted in wide-ranging restrictions across the county, across the country, and within all aspects of children's social care. It impacted directly on the work of the Independent Review Service in Hampshire. Local offices were closed with staff, partners and children families unable to meet face-to-face for conferences or reviews. As well as the rest of the branch, work had to continue with business as usual whilst having to learn to do things differently. In response to these challenges, the RS service worked closely with social care teams and the partner agencies to develop processes that meant child protection case conferences and children looked after reviews would be held virtually. Within 48 hours of lockdown, staff implemented the use of MS Teams to ensure service continuity. Child protection conferences were audio recorded, whilst children looked after reviews continued to have recorded written minutes. To ensure agency decision making was clear in child protection case conferences, each partner agency was asked and continues to submit their decision and analysis via an email to the chair following each conference. These submissions are recorded on the child's electronic record by the child protection chair, and they also give a summary which gives an overview of how the conference was managed and the overall outcome of the decision of the conference. This gives a clear record of decision making and is a safeguard if the recording quality is reduced to poor or interrupted internet connection. Participation of parents and agencies has improved greatly since working virtually, and consideration will be given about the use of virtual and hybrid meetings following the ease of COVID-19 restrictions due to the success. Another positive is that adjourned and cancelled conferences have remained very low in numbers since COVID-19. Children have reported to our staff that they like the use of MS Teams and WhatsApps, and independent reviewing officers have reported that they've seen some improvement in children's participation in their looked after children reviews, although this is very much dependent on their ages and their levels of understanding. The RS service will be undertaking a participation audit in spring to establish how the use of MS Teams and WhatsApp has impacted on children's engagement within their review. Overall, we've continued to deliver an effective service during these uncertain times, and what we've learned from working virtually will be considered in taking the service forward in the future. This is a very quick summary of the key points of the annual report, and thank you for allowing me the opportunity of presenting to you this afternoon, and I welcome any questions.
Thank you very much. Councillor Mitchell, you have a question.
Thank you, Chair. In fact, I have three quick questions, if that's okay. The first is a technical question. You use the annual year July to July, which seems quite an unusual year to pick. So that's probably, I just wonder what the reasoning behind that was.
Every local authority submits their annual report July time, or so it fits with other local authorities.
Okay, thank you. The next one was, I'm very pleased to see how well the virtual meetings are going. I just wondered whether there was, you'd done any research or looked into the difference in being able to read body language and sort of interaction. It's a very different experience on screen.
It is a very different experience, and what we'll be doing is running a participation survey possibly in March time, looking at the experiences of family and children. What the chairs have reported is that's one of the key issues that they find the hardest is being unable to read a parent's body language. What parents have reported back though is prior to COVID, we would hold formal meetings where the professionals would be sat in the room and the parents would have to walk into the room, and they found that very intimidating. It's also quite difficult when we have to use interpreters working virtually as well, because those conferences tend to go on slightly longer. So going forward, what we're potentially or will be considering and looking at is having the professionals virtually on screen, and having the social worker, the CP, the child protection chair, and the family members within a meeting room, which gives them a bit more support without the intimidation of having all the professionals available. What we will be doing though is trialling it and going out and researching it a little bit more. There is the Nuffield Centre has undertaken some research, and they at 300 families, and the report from working virtually, they found that families have found that it was quite a negative experience. So we'll be using some of that research as well when we're looking at how we're going to move the service forward in the future.
Thank you. It's good to know that it's being looked at. I think in my experience, it can actually feel quite confrontational if you are in one place and everybody else is on the screen, because it feels as if they're in the same place. So I imagine that if you're in what could be quite a tense situation, that could be magnified.
Yes. Yeah.
And the third question was around use of email following up after, as I understood you to be saying that after virtual conferences and so on, there would be an email which would go on the file. I was just wondering, are those emails encrypted? Because it's quite easy to send emails to the wrong place.
No, they're sent through a secure link.
Thank you.
Councillor Briggs.
Thank you, Chairman, and thank you, Karen, for the report. Something I just don't understand. IRO is Independent Reviewing Officer, isn't it?
Yes, that's right.
Yeah, so are you employed by Hampshire? I've read about all the vacancies and the troubles with some of the troubles of filling them. Yeah. So I just don't quite understand how it works. If you're independent, you're looking at a child's case. If I take a child in care, you look to see that we're doing the best that we can for them and then plan for them to go on, don't you?
Yes, what an independent reviewing officer does is it ensures that the corporate parent, being Hampshire County Council, and the partner agencies are fully meeting that child's needs whilst they're in the local authority's care. And so in order to do that, what they have to look at is not their care from the foster placement or residential home, or family member if they're placed with a family member. It's also considering their health, their education, their social needs. So they go through the whole remit of a child's full needs. And then from within a review, they will review the child care plan, and they will make decisions in order to make sure that the child's needs are fully met. So it could be an example that a child would like to go horse riding, so we may, if they've got poor social skills, we may ask the school to look into that for them so that they can help with their social skills. So it's about how can a child overcome their past traumatic experiences, but also move them forward in the future so they're able to maintain a normal, healthy life.
Thank you. It's just the word independent that I just didn't quite understand. And my other question was, an average caseload is 50 to 70 children? That seems enormous.
Yes, but a caseload for an independent reviewing officer and child protection chair is very different to a social worker. A social worker actively work their caseload on a day-to-day basis. An IRO's caseload, they will work one child or one family up to 3 times a year. So they will only hold a meeting for that child or family 3 times a year. So when you're looking at their caseload, it's the actual workload behind that. And although it appears large in numbers, it is manageable.
Thank you. And then just quickly, what is the background of an IRO? Is it like you've been a social worker? How do you become an IRO?
Yeah. An independent reviewing officer has to have a social work degree. They have to have the minimum experience of 5 years, and they have to be of a team manager or assistant team manager level. In the reviewing service, our retention is very good. It's very rare we have to recruit to positions. And that's generally because the IROs are where they've been through, they've gone through, they've got 20 years experience, and they really want to try and help improve the outcome for children, or they want to use their skills in safeguarding so that the CP chair role and the independent reviewing officer fits that remit. So we tend to have probably people that are later on in their career join the reviewing service. So they're very, very highly skilled and very experienced managers.
Thank you very much.
I'm pleased to hear that IRO is not Inland Revenue Officer. I was a bit worried there for a minute. Councillor Carpenter, you're next, please.
Thank you very much, Chairman. Yes, I'm going back right to the beginning of your presentation, Karen. Thank you. I'm always interested in this strength-based approach, and you talk about how by using this approach that more of our children end up staying at home. Yeah. I just wonder what, this is sort of an operational question really, but I just wonder actually what is changed within the family in order that that result comes about, if you see what I mean. So I'm sorry, somebody's just, excuse me everybody, somebody's just waving through the window and put me off. Thank you. Sorry about that, I do apologise. I just wondered what has actually changed within the family and how that approach works, whereas it didn't before, but it works now, and it prevents children from actually, going into care.
I think prior to the strength-based approach, families would look at children's services as being there to remove their children rather than actually being a support. And what we've learned through using the strength-based approach is language is really important. So within child protection meetings, what we do is change our language to be more strength-based. So rather than saying you haven't fed your child, we now say what would help you in order to maintain a good diet for your child. So what we do is we break down their issues and their problems. We get them to accept how they move on, and then we support them in areas that they identify where they feel that they need the level of support. So it's I would say it's like ownership. They're taking ownership of their problems rather than us waving a stick saying this is what you're not doing and blaming them. So it's around language and about participation and engagement rather than taking a draconian way of saying you're not doing this and you're not doing that. So it's very much key on how we use our language. And families, when they don't feel blamed or shamed or feeling guilty, they tend to be more receptive to what we're saying to them and how we work with them. So it's moving them forward in a real positive light, with their acceptance that they would like the help and support, rather than no, we're not taking your help and support.
Okay, thank you. I'm sorry about that interruption as well in the middle, threw me off. Thank you.
Councillor Porter.
Thank you. I thought I read it, but I wasn't quite sure. Thank you very much. I've got 4 questions. The first one I think we've sort of touched on. You mentioned that the average caseloads were 83, but actually the recommended was 50 to 70. How confident are you that you can cope with 83 when an average? Because that will mean that some people have got more than 83.
Well, they would have no more than 83. So when we're saying an average, it's with an independent reviewing officer, their workload can increase and decrease almost on a daily basis. So where we do the dual role part is that if they've been a child protection chair and then unfortunately those children have had to come into our care, they will then automatically pick those children up or that family up as an individual reviewing officer. So if they had a caseload of 65 and there was 5 children in that family, within a day their caseload could go to 70.
Oh, I see.
Does that make sense?
Yeah, it does.
But just to give you some reassurance is that their numbers will fluctuate. But in December, we had 35 children exit care and 36 children came into care. So it's only an increase of 1 child. So throughout December and November and actually most of January, their caseloads have been stable.
Thank you. Second one was you talked about the success of being online, and actually I think Pal Hare mentioned that. Oh no, it's Fiona. Sorry, it's Councillor Mitchell. I think that mentioned that our experience of joining in meetings like this is the disempowerment of someone who's sitting in a room with somebody else compared to someone who's sitting in this setup. Is there a potential for an IT upgrade or capital spending on this in order to improve that situation? Bearing in mind that most young people and their families will be out of this sort of scenario and they might be on a telephone or whatever. So is there a constant conversation about improving the IT?
Well, what we're doing within Hampshire is that we are updating our computer systems to a new Mosaic system. So we've built an awful lot of things into the Mosaic system. In regards to working on screen, there may be, when we eventually go back to offices, there may be a small cost in regards to those offices that do not have screens in, but the majority of the big buildings do. So I think, it would be dependent on when and where we go back into offices to manage the child protection conferences.
Thank you. And one of the conversations that I always hear from schools and children's homes is school placements. How have you managed to cope with that during the whole COVID problem? Has that been easier or more difficult?
Well, for any child on a child protection plan or a child that's looked after, they are deemed to be vulnerable children and they have to be given a school place. So the majority of those have been attending school. The difficulty being for us, it's when it's the foster carers, if they've got anybody vulnerable within the household, it's their anxiety of having that child going in and out of school. So we've had to do a bit of work with our foster carers around alleviating some of that anxiety. When children are going to school, though, they are going into the bubbles. The schools are being very proactive in keeping the children safe. Our experience throughout the whole COVID is schools have engaged really well with both child protection and our looked after children. They've continued to attend all the meetings, and it's been a real success.
Good. Thank you very much indeed.
Councillor Wade.
Thank you, Chairman. Yeah, Karen, thank you for the report. I've got sort of a couple of questions. Taking into account that you've obviously got more caseloads to deal with than is ideal, I've got from the report and your presentation that it's beyond just auditing to make sure that good practice is being followed. It's actually trying to improve to better good practice, if you pardon that expression. And I noticed in the report it says there was a big contribution to the Hampshire Approach. Can you sort of describe what level of that contribution to the Hampshire Approach is? I mean, you've given some examples and they were very good ones, but can you just sort of quantify that? Because if with the Hampshire Approach is being developed by the service user, and you are in effect an auditor of the service user, I'm just to understand what your level of input to that is, if that's a fair question.
Yes, it's a very, very fair question. The RRS service have been involved in all of the transformation programme throughout the whole of the county. So one example would be the development of the child protection plan and making that strength-based and feeding back about what was working previously and what wasn't working so well. We also looked at other agencies and local councils to feed back in what we've heard, what worked well and what didn't work well. And then we also took it out to trial in certain areas and fed that back. So we've had, we've been key players in the transformation programme. We've also developed the children and families assessment and made that more strength-based, as well as children's care plans. So all the way through the transformation, we've been fully engaged. On top of that, each independent reviewing officer is linked to team meetings. So each team around the district has a linked IRO. So they will go in and they will do any training of any new systems that are coming out. So we're very embedded in the teams, even though we're independent.
So really, you have to understand all the new procedures on top of the existing ones to be able to focus or train on that as well.
Absolutely. But a lot of the time we are in those meetings, so we've been fully engaged within that whole process.
Okay, thank you.
Members, I see no more questions, so if that is the case, then I want to say a big thank you to Karen for her presentation here this afternoon. Thank you very much indeed. And members, we'll move on to item 9, please. Sorry, very quickly. We have a recommendation to note that presentation. Are you happy to note it, please?
Agreed.
Thank you very much indeed. Did somebody say something? No. Okay. We'll move on to item 9 now, which is an update on lockdown 3. And that's going to be given to us by Stuart Ashley. Welcome, Stuart, and thank you. Off you go.
Thank you, Chairman. Good afternoon, members. It's a good discussion this afternoon, I thought. And we'll end it on a positive with lockdown version 3.0. Members, you've seen many of these slides. I'm not going to project them. I'm just going to walk you through them, probably at pace, and I will focus on slides towards the end about the current situation. But I do think it's important that as an advisory panel, you understand how we're continuing to manage the service, given lockdown, out of lockdown, tier 3, tier 4 lockdown. It's a complicated process, particularly as we know that issues around vulnerability have exacerbated during periods of lockdown and the easement of lockdown as well. So if I take you first to slide 3, which is titled Our Approach Through Lockdown. Again, I know you'll remember this from before, but back in March I developed a 3-phased approach. Phase 1 being business as usual, but doing it differently. Phase 2 was actually, as we had significantly reduced staffing, going on to a sort of preemptive planning scenario. And then phase 3 was the worst case scenario. Throughout lockdowns 1, 2 and our current lockdown, we have remained in phase 1, which has been really, really positive. So it's business as usual, but we're just doing it differently. As you heard and have experienced as we're doing this committee meeting differently, doing things virtually. Interestingly, I get a weekly update on visits, the difference between face-to-face visits and virtual visits by my social workers and other practitioners. And I'd expected that to go right down to sort of 90-10, to 90% virtual. It's actually been somewhere between 1 in 4 and actually 1 in 3. So, and it does change on a weekly basis because it depends on the vulnerability of the children. But there are still social workers going out there every day using PPE, using social distancing, seeing children face to face, because that's the right thing to do and that's what they've needed to do. So yes, it's business as usual, we're doing it differently, but it's not always doing it completely differently, if I can put it that way. The one thing I would just touch on this slide, where you've got the phase 2, which is where you go into the sort of preemptive planning for the worst case scenario. We almost got to that position with Swanwick Lodge. We had an outbreak at Swanwick Lodge. The secure unit was always, myself and the director have spoken about it. I think it came up at select committee. We always said that was our one area of biggest area of concern. Those children can't go anywhere, they're insecure. So how do you manage if you get an outbreak? And we have an outbreak. The staff have been exceptionally supportive. We created something called work bubbles so that they were self-isolating at home but coming into work as a bubble, as a team. But that was the way that we kept the unit going, and I'm exceptionally grateful for those staff. The situation has improved since then. We've had more staff come back to work, and everybody's well. We've still got some other people off sick where they've caught COVID outside of Swanwick, but this was actually an outbreak within the unit, which I think was managed really well. And the other part of the service that has particularly experienced difficulty between lockdown 2 and 3 has been our out of hours service. The demand out of hours, so between the hours of 5 and 8:30 in the morning, since the beginning of lockdown 1, we've experienced significant pressure there. We've put more staffing in, more management oversight, but we had a number of staff who had to self-isolate and then tested positive, and that does happen because they have to work, they have to go out together, as particularly out of hours where you're maybe on your own. We can't always go out on our own if we don't know what the situation is, and so we had some pressure in that part of the service as well. Just going back to the next slide then, which is maintaining management grip. Interestingly enough, before I came to this committee meeting, I was talking to some newly qualified social workers who have just joined Hampshire, and I was making the point that whilst from a management point of view, we do have some tight management grip on the service, and we've deliberately kept that throughout the pandemic. What we've also done is actually empower our social workers and team managers to use their judgment. Yes, we want there to be an audit trail around the decision making, but one of the things that I've been keen to do is to allow social workers and their team manager to make the decision about which child needs to be seen face to face and which children don't, and then to move that around so that over 2 or 3 weeks every child gets seen. Some children get seen every week because of the priority. That's about professional judgment, and so whilst we've kept the managerial layers in place to promote safe practice, we've also encouraged professional judgment, which I think in these circumstances is the right thing to do. If I just move on to the activity data, and I'll just translate there so you have at the top referrals, the amount of assessments we've been doing, how they were completed, how many were completed within timescales, the numbers of initial child protection conferences, so where a child is deemed to be at significant risk, there's a multi-agency conference, and then the review child protection conferences, which happen within about 4 months, sometimes earlier, of the initial conference. The numbers there speak for themselves. I mean, the performance around the timescales is exceptionally strong. I can't say anything other than that. What I would say about demand levels and volume is in March and April, lockdown 1, demand went down. It was as if we were in July and the schools had closed, which of course technically they had. The schools had closed, and we experienced that. Our demand dropped significantly. Even with the schools closed, by May we were back to normal levels of demand, and I was somewhat concerned about that. And the director and I did some sort of modelling, and we predicted that coming out of lockdown, we would see an increase, about a 15% increase. Between a 10 and 20% was our best estimate. By June and July, we were seeing that 10 to 20% over demand, and that 15%, which is almost spot on where it's been, has been maintained ever since. October and November were even higher than that, and the service was really feeling the strain. As we got into December, it went back down to being about 15% over, and then as we went into the new lockdown, the one that we're currently in, it's dropped a little, but it hasn't. It's just at normal levels. It's not at below normal levels. And my other comment on the demand for children's social care is the complexity of what we've seen. Families that we may not know, families that we may not in normal circumstances work with, have come to our attention. Yes, there's been a rise in domestic abuse. Yes, there's been a rise in emotional well-being issues and mental health issues. But there's also been a rise in families going into crisis, and that leading to increased incidents of neglect or child abuse. And we know social workers are having to deal with that. That seems, and this is my sort of professional view on that, is that was more prevalent in lockdown 1, a little less prevalent in lockdown 2, and again a little less prevalent in lockdown 3. And the reason I think that complexity has eased a little is because agencies other than children's services have adapted to lockdowns. So some services that weren't around in March through to June are around now to support those vulnerable families. So I think that's a good thing for the partnership. I'm aware of time, so I shall move on. The next slide is around visiting data. It just gives you an idea of the volume of visits that we're doing, whether they're virtual or whether they're face-to-face and in-person visits. And I mean, there are a significant number that happen day in, day out. I won't linger on that slide anymore. The next slide, again, should be familiar to members of the advisory panel. So this is just the apps that we use. Even I'm familiar with them now, and I know what they do. And staff have been very creative in their use of technology and their use of those apps to engage, not just engage with, but to make sure they get the feedback and the lived experience of the child and indeed the parents on some occasions. The next slide relates to children in care, and it's been really remarkable actually that we have seen a reduction in the numbers of foster placements and children's homes placements that have broken down over the last year. A reflection of, I don't know if this is the right way of putting it, but it feels like the sort of, we're all in this together, so we need to look after each other. And I just wonder if that has, particularly for our more vulnerable, emotionally vulnerable children in care, whether actually spending more dedicated time with their foster parents or their residential workers has really, no pun intended, fostered those relationships and improved them. And I think that's been a sort of remarkable learning point for me, that we have had some breakdowns, of course, but nowhere near what we would normally see. That's about people wanting to do the very best for our vulnerable children. And the children themselves, they're in regular contact with their social workers. There's been lots of creative ways of engaging them. Many are attending school. Our school attendance figures for our vulnerable children are, the last time I spoke to Brian Pope last week, were 10% above national, a reflection of the good work his staff are doing with social workers and indeed our family of schools in Hampshire, there's been a really good triangular approach to ensuring that vulnerable children are attending school. It was touched on by Karen in her presentation. Sometimes it's difficult for foster carers where they may be clinically vulnerable, or someone in the household is, and then having to send their children to school. And that just takes time and emotional support for those foster carers to reassure them that that's still the right thing to do. Just moving on to the next slide. I think I've covered this actually. I won't go through foster carers and residential again, other than to say, even in lockdown 3, we continue to see them go to remarkable lengths. One issue I would raise, and I think it's only right that I do, is there's a growing anxiety amongst our foster carers that they are not a prioritisation for the vaccine, and they're not. We have had lots of discussions with them and comms, but we have to follow the JCVI list. It's a national issue. It's been raised. It's not a Hampshire issue. This is a national issue that foster carers are not considered to be a priority. And this is, I absolutely get where foster carers are at. If we could prioritise, if I was allowed to prioritise them, I would. But it's a national issue. not one that we can ourselves remedy, but I do recognise the tensions for them in that. Partners, as the next slide, will continue to work really well with partners. Partnership working has always been a strength in Hampshire, and it continues to be now. The next slide talks about our staff. I suppose in lockdown 3, what I would say is morale dropped shortly after Christmas and the New Year with the announcement of lockdown 3. I think, part of me says morale usually drops after Christmas and the New Year. At the best of times, we know that, but it did drop. It dropped quite fast, but surprisingly this time it bounced back even more quickly. So within a week, the feedback I was getting is, yeah, we were all really, really glum that it happened yet again. Here we are in a lockdown, but actually we know we can deal with this and we'll be okay. So let's get on with the job. And of course, individual teams, we have, probably 200 teams in Hampshire. Individual teams will have difficult times, but in the main, morale in the service remains strong, and I'm pleased with that. And I think that's a testament to the resilience of our workforce. One of the things I would say is we have seen more staff become unwell or having to self-isolate since December. The numbers actually have improved through February, but we did see increased numbers of infections amongst our staff, to be expected because that was reflecting the pattern nationally and across Hampshire. But I'm pleased to say that particularly in February we've started to see increased numbers of staff coming back, less staff going off, which is a positive thing. The next slide is about connectivity, and I think you've heard enough from some of the other presentations about the virtual working, so I won't repeat that. And then on the lockdown 3, I think I've covered most of the points here as we've gone along. Yes, I suppose the very the last bullet point, the bottom of the slide titled Lockdown 3. When I say business as usual in children's services and children's social care, I really do mean business as usual. We have continued to offer improvement support to other local authorities who are inadequate or who are struggling to improve their services. Now, we've been able to do that virtually, but I think that's a testament to the workforce that we have in the department, that we really have kept all of the work going. We haven't stopped this. Even that external facing work has been maintained. And of course, that's a small source of income for the County Council. And then the next slide, which I won't go through, gives some examples of the feedback we've had from staff and the feedback we've had from children. There's a slide on what we've learned, which I think we've covered many times before. And I will just move on to the very last, the penultimate slide that says, in conclusion. So business as usual, we're doing it differently in lockdown 3. We've maintained that oversight to keep the service safe, make sure that our children are being seen, listened to and are safe. All of our staff and our foster carers have been going over and above. Our work with agencies has been collaborative and responsive, and I think we've learned a lot that will stand us in really good stead for I don't know whether it's post-pandemic, but post the COVID crisis. We will work differently in the future. That's very much some positive learning that's come out of this. And I see the world as a hybrid world, a mixture of face-to-face and virtual. I think that's both efficient, effective, and actually the feedback from my staff is that really helps with the home work-life balance as well. So we're in a good position, as good a position as we can be as we come to, what are we, midway through lockdown 3. But I think that's a reflection of the resilience of the workforce. Thank you, Chairman.
Thank you very much for that. Right, questions. First of all, Councillor Mitchell.
Thank you, Chair. I was going to ask about staff resilience, and it's great to hear that staff bounce back from what I think everybody experienced as a bit of a slump after Christmas. But do you have any information about staff absence that's mental health related, stress related, rather than sickness related, and how it compares to the same time last year, for example?
We do, and actually, technically, there are less staff off. But I think that's probably and it sounds a bit odd. That's probably because we're putting in enhanced support. So, for example, a social worker in a normal day might see their team manager once when they're in the office. Now they might speak to them and see them via Teams 3 or 4 times a day. So I think that we're having to put much higher levels of support into our staff. I think that is not only helping them manage COVID, but that's just helping generally. Mental health is always, and stress related actually is what is usually high in my branch, understandably because of the nature of the work. But we haven't seen a massive shift with that one way or the other. But I think we will. What we all know is at some point, when we get through this to whatever that is, it will have an impact, won't it? It will have an impact probably for several years for many parts of not just my service, but the county council and organisations nationally. So I expect there's more to come on that, Councillor.
Councillor Hare.
Thank you. Sorry, I did think it was you. Myself. Stuart, this is a really good presentation. In your slide, Children in Care, you talk a lot about recruiting volunteers. And given that we've been talking a lot about safeguarding today, are these volunteers? Who are these volunteers, and how are they recruited?
So our volunteers, it's something that we did at the beginning of. We really started it around 2017. They're volunteers from all walks of life, but the key questions are, well, as I would ask them, are they trained? Absolutely they are. Are they DBS checked? Absolutely they are. Do they get supervision? Absolutely they do. So they are, but they are people from all walks of life, and we don't just use them with our children in care, although we will. We might, for example, see if one could supervise some contact for us because the contact supervisor is unwell, and we don't want to disrupt the child's contact with, I don't know, an aunt or an uncle. So we use them when they're available in a number of different ways, and I think it's a healthy thing to have volunteers that are part of our workforce, if I can use that way. But they are robustly vetted, if I can say that. The same checks are applied to our volunteers as they are to our general workforce.
Thank you. That's reassuring. Thank you.
Councillor Porter, please.
Thank you. First of all, I'd like to say I think of all the departments I've dealt with throughout the whole of this last year, Children's Services have been the most quickly reactive and the most nimble in getting back up to business as usual. And perhaps that's the age of the workforce or just the willingness to do the job. So thank you very much, Stuart. Really appreciate it. I'm just going to raise 2 things, really. One, you talked about allowing staff to use professional judgment. And again, Councillor Mitchell related this to supervision needed. And the fact that your assessment within timescale went up from 91.3 to 95.6 in December 2020. But actually one of the frustrations in the list was about the court services and the other services who might not have been as agile as your department in business as usual. Is there any conversation that we can be having with those other organisations, those other partners, to see how we can make it better for the future, bearing in mind that actually online seems to have worked for this area of work?
That's a really good question. I'm going to start with the negative and then I'll move into the positive. So the negative is my experience, over 20 years experience, is I'm not often able to influence the courts, unfortunately. And that has proved problematic. In fairness to the family justice system across Hampshire, we have seen an improvement with the virtual, and I think there's an acknowledgement from lawyers, as well as certainly my staff, but I think lawyers across Hampshire, that maintaining some virtual will speed the court process up in the longer term. But that has been a slight obstacle at times for us and a frustration. Yes, we're able to challenge partners. I'll give you a really good example, or 2, if I can. So for our child protection conferences, we have a lot going on, as you'll have seen from the numbers. Getting police attendance for everyone was difficult just because of the size of the team they had, the number of conferences and the size of Hampshire. And getting a GP to attend was even more difficult because they're incredibly busy people. Yet through the pandemic, we've had better GP attendance because they can dial in for a slot via Teams, say what they need to say, give their view and leave. And the police have been able to service 100% of our child protection conferences. So they've acknowledged that that's learning for them. That's a way to be able to deliver a service in the future. And we need to accommodate that going forward because it's a good thing to have as many partners around the table taking responsibility for improving those outcomes. So we have been able to influence partners. I don't think we've come across any major obstacles where we said we just can't do it. And that reflects as much on partners as it does on children's services, I think, the sort of can-do attitude. So it's pretty much a good news story in the sense of the partnership.
Councillor Edgar. You're muted, Peter.
Thank you, David. Thank you for the bringing this thing forward today with everything in it. I haven't had time to come back and answer things. It's quite difficult for me to do that. But I'd just like a general point to make. I go around about an hour a day, talk to people at long distances because I can't meet any at home, and I'm not supposed to be speaking to people outside. But the thing that worries me is that this massive challenge that you're meeting as well, and we are committed to, I am very worried about what comes together, the government, the local authority and authorities generally, and particularly for care of families and young. I am very, very worried at what is coming round the corner. The commitment is fantastic, particularly at the county, and I get tremendous support from families when they have a problem, but I have incredible worries about the future. I could say from the old to the young if you want, but I do think the future will be decided on the young because they will be deciding our future. And I'm very, very concerned that we are not giving it enough commitment politically that we should do. We're going to have a massive mix up now because we're going to have the people who with a lot of experience are going to be just kicked out. It's going to be a very difficult time for people to make decisions. When we're making decisions, we could have a complete different setup altogether. And I can honestly say this because I obviously don't, I will not be continuing anyway. But I am very worried about this future. I'm very encouraged by County Council's approach to all the other things that I've raised with the county since we've had this problem, particularly for this last year. Sorry, it was a comment, really.
Perhaps I could, Chairman, if I could, perhaps I could just make a comment.
I was going to say, do you want to comment, Stuart?
A children and families perspective. One of the things that I think my service has shown itself over the last 12 months has been its adaptability and how we are able to respond to changing demand levels, increased complexity. We don't do that in isolation. It's part of the Children's Safeguarding Partnership. We all work together with the police, health, third sector partners. So I share Councillor Edgar's concern that there's going to be unknown and likely change one way or another. But I think if any Children's Safeguarding Partnership is equipped to respond to that, then it's the Hampshire one, in my view. Thank you.
Councillor Wade.
Thank you.
Thank you, Chairman. And Stuart, I would echo what Jackie said. From dealing with issues in my division to things I come across on the broader landscape, I think Children's Services have reacted really well during this pandemic. You've all done a good job. So you know, take my hat off to you. Well done. It's been a quite challenging time. I want to ask you a question about something you sort of alluded to earlier. If we take aside the discovery of virtual meetings, dealing with counsellors, clients, young people, social workers to their children, if we take all that aside as a big way things are going to change, and take into account what Councillor Edgar said. There's going to be some serious challenges from financial support, etc., and the outfall of the pandemic going forward that will affect all areas of local government, most areas of local government. But has there been any, what is euphemistically in some businesses called blue sky thinking, of how the service might change to meet the challenges in the post-COVID world beyond the use of Zoom and this type of technology? Have you talked about how, based on experience that you've come across, and you are always in this sort of a strange environment, come across things you haven't come across before that may not just be reflective of the pandemic. So have there been any thinking how the service might perhaps evolve, is the word, rather than change, beyond that, obviously the use of technology? Just a question, really.
It's a really helpful question, and it's a question that the newly qualified social workers asked me this morning as well, and I think we've done some really deep blue sky thinking, Councillor Wade. I genuinely do. So I'd answer it in three ways. One is we transformed children's social care. That was recognised as a contribution to becoming an outstanding children's services. But I've said before, we didn't stop there. That was phase one. We're still pushing it at our second phase of transformation around how we work with families, how we support children in care and drive on those best outcomes. And I have the challenge that I've set for my service is to be groundbreaking, because in children's social we are one of the most heavily regulated parts of the council, and that can stifle innovation and creation. But we have to be, I think, brave enough to actually face that challenge and say, no, we've got to look forward, and we've got to be groundbreaking. A simple example, Hampshire House is no longer part of, no longer serves my staff in Eastleigh, but we're looking at developing a building that will be fit for the next 10 years in a post-COVID world. Think of it as a Google type space where staff from agencies can come together safely to collaborate, not having staff going into the office all the time, but working differently, perhaps working extended hours. And by extended hours, I mean, if it's easier for, I don't know, one of my social workers who is a mother to a young child, if she wants to work more in the evening because that fits with her lifestyle, then why can't we make that happen? We've got to be so much more flexible. I then think there is some of what I've been talking about with my managers is I'm convinced that we can respond to the demand issues. Where we need to go now is we need to be, in a positive way, challenging the Department for Education, saying that we know we can do things better and differently. You have to give us more support and more flexibility to do that. Some of those regulations, why not in Hampshire's an outstanding children's services, why not pilot something different in Hampshire? But we have to put ourselves forward, and I think, and it served us well, we have got a humility, I'd like to think, but sometimes you might have to just take that off for a bit to really go the next step. And I suppose that's where I'm at. So we've been thinking long and hard, and one of my final points would be, I have been saying we need a children's services that's fit for the next decade. And what does that mean for us? What does that mean for our children and families? Yes, of course, technology, but I think it's more than that. One of the things we've seen an increase in people wanting to inquire about being a foster carer because the pandemic has made people reflect on their lives. And I'd like to think that means as a society there'll be some changes, positive changes, but we need to be driving that from the children's services. So yes, we have. Have I got all the answers? Not yet, or I'd be the director. But we're certainly pushing all the boundaries, I think, in terms of that innovation and transformation. I hope that answers the question.
Yeah. Thank you, Stuart. It's a good answer.
I think Councillor Keast has
disappeared.
Vanished. Must have been a technical issue.
I was the last one with my hand up, and It's not a question, because I think the report is so comprehensive, and just want to thank you all. I think it's an amazing job in speaking to social workers, how hard they are working. But I just wanted to say there is some positives from COVID, because having attended 2 HFN virtual meetings, a lot of the foster parents have enjoyed the extra time with their children. They really felt they got to know them. So even though it's been hard, there has been some good come out of it. That's really all I just wanted to say, because I think that was really positive. They were asked how they felt, and instead of moaning and saying, oh, the children were around too much, they were so pleased with it, you know, the time they were allowed to spend with them. So that's all I really wanted to say. I'm sorry, Councillor Keith must have been having problems at the moment.
Yes.
Oh, excuse me, my husband's just had a phone call from him.
Yeah, he can't get in. He's trying to get in.
Okay.
They won't let him in on his laptop.
Councillor Keith just rang up, and he's having problems and he can't get back in again.
Thank you. Thank you, Anne. Shall I take over from there, as Councillor Keith is not?
Yes, please.
Is having problems.
Please do.
I think we're basically done now. Any more questions from anyone? No hands up. Thank you, Stuart. That was a. Oh, sorry, Councillor Porter.
I'm just going to say the one thing that actually probably Councillor Keith's situation does describe is actually the frustration with the IT when it doesn't work, and I think that was I think January taught everybody to be kinder to each other about that after Christmas. I think there was definitely a move about that and supportive of each other, and I think that's a strength as well that's come out through the whole county council. So thank you, Stuart.
Thank you.
I am back with you. I apologise for that. It's been seen that my iPad has run out of juice. It tells me I've got 6 minutes left. I thought I was going to get to the end of the meeting, but I haven't. So apologies for that. Has everybody spoken now? Yes.
Yes.
I've got one question, Stuart. Those of us that have been on the panel for a long time will be aware that perhaps 4 or 5 years ago, the children in care was probably about 1,050. There was a spike after baby P, which shot it up to about 1,150. We're now sitting well over 1,600. Do you ever see a time when that's going to come back down again, or do you see it's going to be the constant figure?
It's a challenging question. So nationally, well, first of all, we have to think about the population. As we build more houses in Hampshire, the population will grow. I know for every 10,000 children in Hampshire, 60 of them will end up in care. That's just the way it is. Having said that, over the last 2 years, and if we go back pre-COVID, over the last 2 years, nationally, there has been a 5% increase in the numbers of children in care. That's a national rise. Because of our New Hampshire approach, pre-COVID, we had seen a 4% reduction. So that's a 9 percentage point swing, which I think is significant. And our numbers were very clearly reducing as a result of the different work that social workers were doing. COVID has tested that, of course, and the numbers have gone up again, as they have nationally. I've heard numbers as high as 8 to 9%. Ours haven't gone up that much. And in fact, of late, they've started to plateau as we've properly adapted to the new ways of working. I'm confident that with a fair wind and the right conditions, that we can get back to where we were, and we should at least see the numbers plateau, if not reduce. Social workers tell me that actually the new tools that they have, their new way of thinking, working with families, actually really does make a lasting difference. Children will always need to come into care, that's a given. They absolutely will. There are some children who will come into care and we won't be able to reunite them with their families, as sad as that is. But in those cases, it's absolutely necessary that they have permanent maternity. But we do, teenagers that come into care, I think we're really optimistic that we can get increasing numbers back within their family network. May not be back with their parents or their parent, but it may be within their family network. So we've got good evidence. A long answer to this, I know. We've got good evidence that pre-COVID, our new ways of working can make a real difference.
Thank you for that. If there's no more questions, it just remains me to thank Stuart very much for his presentation. Members, the recommendation is that you note the presentation. Are you happy to do that?
Agreed.
Thank you. It just remains for me, therefore, to close the meeting. If you could just wait a second while Emma just switches off the broadcast, and then you can close down your meeting. Thank you again for your attendance, and thank you for some excellent questions and answers today. I think it's very informative. Thank you.